Welcome back to another episode of our Healthy Communities podcast. I'm Dr. Phil Wong, Director of Dallas County Health and Human Services, and today we're highlighting our very own STI HIV Prevention Division. I'm joined today by Shelley Cabrera, our Public Health Manager for this department. Thanks for joining us today.
Hello, Dr. Wong. Thank you for having me today.
Well, first, tell me a little bit about yourself and how long you've been with DCHHS.
I've been with Dallas County Health and Human Services for 8 years, and I'm currently the program manager in the STI HIV Division.
Great. And so let's talk a little bit about the important work you do with the STI HIV Division. What all are you doing down there?
Well, one of our goals and our missions in our division is to make Dallas County a place where sexually transmitted infections and HIV are prevented, and residents have a low barrier access to quality STI HIV prevention, care, and treatment while living free from stigma and discrimination. And some of our goals are to prevent new STIs and HIV, reduce adverse outcomes of STIs and HIV by expanding our STI prevention activities, reduce STI HIV-related health disparities and health inequities, and lastly, achieve integrated, coordinated efforts that address the STI HIV epidemic.
So how do these align with some of our other efforts, the End the HIV Epidemic or Fast Track Counties?
Great question. One thing that we want to make sure that everyone understands is that STI prevention is HIV prevention. And how we do that is so important in our outreach activities, as well as our partner services. And our partner services, that's where we have trained DIS or disease intervention specialists. Whenever anyone tests positive for STI or HIV, they contact these individuals and make them aware that they've been diagnosed with an STI or HIV. And one of the things that we want to know, because in order for us to reduce the STIs and HIV within Dallas County, we need their assistance, right? So we want to ask them, who exposed you to this STI or HIV? Then who have you exposed, to give everyone the opportunity to get tested and are treated. Because if they're not adequately treated, then they're at risk of being reinfected. So that's one of the ways that we try to tie in within the HIV epidemic.
Yeah, I think most people don't really know that when you get some of these STIs that the health department does contact you to find out more about who might have been also infected or be at risk for transmission, things like that.
Absolutely. And when we contact you, we're going to have that conversation with you, but we're also going to take an opportunity to provide you STI HIV education. We're going to ask you, what do you know about syphilis? What do you know about HIV? We're going to go over your risk factors, because it's important to us that you do activities that reduce your chances of getting this infection again.
So surveillance, partner services, outreach, those are also essential pieces of what you all do. Could you describe a little bit more about what's involved in those activities?
Absolutely. In our surveillance piece of it, we have our HIV surveillance staff and our STI surveillance. In our HIV surveillance, we always hear the stats where HIV is going up and down. It's in a certain age range. It's in a certain demographic. Those components are collected by our HIV surveillance staff. And it's HIV surveillance staff, and it's reported up through CDC. And our STI surveillance staff, they're always monitoring our syphilis labs, chlamydia and gonorrhea labs, to see, do we have a new infection? Has someone contracted a new case of a syphilis? And they then initiate that to our disease intervention specialists or DIS, so they can reach out to those people. And that's part of that's what our surveillance staff do. Then the partner services is what I mentioned about earlier, where we contact those people who have been diagnosed with the STI or HIV, and we contact those who have also been exposed. And then we have our outreach component, where we go out in the community and we conduct free STI and HIV testing. That is a vital part of our program, because in conjunction to testing, we test for syphilis, HIV, chlamydia, gonorrhea, and trichomoniasis. And we also provide free condoms to anyone who tests with us. And we also provide education. That education goes over the common STIs. It goes over PrEP and also congenital syphilis.
Tell me more about PrEP. Some people may not know what PrEP is.
PrEP is a medication that's used. We have pill, or we have the injectable, which is Apretude. The pill is taken daily, and it's to prevent HIV. Now, one thing that we always make our clients aware of, that PrEP is for HIV prevention. And most people don't like to use a condom in conjunction with PrEP, but it's highly recommended, because PrEP does not protect you against the other STIs. That's only done with the condom.
Yeah. So how much do your services cost?
Our services, our medical mobile, believe this or not, is absolutely free. It's free to the public. Anyone who walks onto our medical mobile, they have an option of getting tested for syphilis, chlamydia, any STI that they want. It's totally up to them, and it's free. If they come back positive for anything that our sexual health clinic here at Dallas County treats for, that treatment is also free.
Great. So you talk about the medical mobile. Can you tell everyone a little more about what that is exactly?
Our medical mobile unit is very prevalent out in the community. Just a little stats about that. Last year, we tested 1,553 individuals on our medical mobile. With those efforts, we identified 43 new cases of syphilis, 2 new cases of HIV, 21 new cases of gonorrhea, and 73 cases of chlamydia.
Great. So it's important services to get out in the field, out into the community.
Absolutely.
Now, yeah, talk a little bit about some of the experiences you've had in the field. What sort of things do you see and what's it like?
We see all things in the field. And most important, we see how vital our service is. We have clients who use the medical mobile repeatedly for their sexual health testing. We do outreach sometimes here at the health department for extended hours in which our clinic is actually closed. On one occasion, I think we were out here last week and we actually seen a pregnant female, and our staff was able to engage her and ask her, was she in prenatal care? Had she gotten her syphilis testing or her HIV testing? And she had not. So we were able to engage her, get her tested, and then make that referral to actually prenatal care.
So how can people find out about your services and where you're testing?
Absolutely. That's a great question. Our calendar is posted on the Dallas County Health and Human Services website. If you go into the clinical tab and look at the sexual health medical mobile, our calendar is posted there. And then our wonderful PIOs also post our locations on social media. And just a really quick question that I want to ask you about. Since the signing of the Declaration for Ending the HIV Epidemic, how important was that for Dallas County?
Well, it really is very important for our community. You know, the goals are 95, 95, 95 by 2030, so that 95% of persons who have HIV know their status, 95% of those persons are on sustained treatment, and 95% of those persons on sustained treatment are actually virally suppressed, and they can't, there's no transmission when you get that viral suppression. So it's really important goals for our whole community to work together towards. So it's, getting people tested, getting rapid linkage to care, and re-engaging people who are out of care and getting them virally suppressed. And then also we have the goals and trying to end stigma related to HIV. So again, when we have these common goals, working with all our community partners, it brings us all together to have that common objective.
I agree. Thank you so much.
Thank you, Shelley, for joining us today. We'll see you in our next episode, where we'll continue the conversation about DCHHS programs and services. Don't forget to like and subscribe to our channel. We'll see you soon.